Well, choosing a Medicare plan is one of those decisions that can impact a lot of things, like your health and your wallet. You can't have a one-size-fits-all approach when shopping for coverage, and that deadline to sign up is inching closer and closer. Chuck Swenson is the Senior Vice President at United Healthcare, Medicare, and Retirement. He's going to help us navigate this. All right, so I know for my plan, they're saying December 7th is the deadline, but what about the Medicare deadline? When is it?
Yeah, so that is the deadline for Medicare. You're right. It's the annual enrollment period for Medicare, and it is December 7th, so it's coming up in a few precious days.
Why is it so important people get it done like right then? Is there not a leeway, a little extra time there?
Sure. So every year the annual enrollment period is technically it's 54 days. It's from October 15th through December 7th. And most people get lots of information in the mail or even from their current health plan that gives them the option to take a look. The reason why it's important is these plans, a lot of times, they can change from year to year. And so if you're in a current plan right now, you should have already received something that says if anything's changing. And that could be anything from, are your doctors in the network, or has anything changed with the medications that are covered? What other benefits are added? So when you have this 54-day period to take a look at your plan, you may quickly find out that you're in the right plan and you're good to go for January 1st of the next year. But if something's changed within the plan or even within your own personal situation, this is your chance to look for some other options.
What are all the different parts? Is something I don't understand. The different parts of Medicare.
So it can be confusing at times. So and no one's alone with that. So a couple things of the basics, the ABCs of Medicare. Part A is really around hospitalization. Part B is around doctor's visits. Those two parts, A and B, are typically what's covered with original Medicare, and you're usually covered at 80% of those costs. You have to cover the other 20%. So that's A and B. I'm going to fast forward to Part D. D is actually prescription drug plans, and those are provided by private insurance companies. And then if you were to take all of those parts, A, B, and D, and put them together into one, that's Part C. So think of it as A plus B plus most likely D equals C, which is really Medicare Advantage. And Medicare Advantage is actually what private insurance companies provide for that specific health plan.
Well, you said there would be no math in this, and so now I can see why people get so confused by this. A plus B plus D can equal C. All right, so there's a lot of information to uncover. Right. I've already learned a bunch. How do we get more information about this? How can people really dig into this?
So to really dig into this, if you want more information, and again, you need to go through your specific situation and see what's changed. If you go to, we have resources right now to help people before this deadline at uhcmedicarehealthplans.com. So that's uhcmedicarehealthplans.com.
I appreciate your time. Such an important topic, folks. And get more information by checking this segment out again on our website, firstcoastliving.net.